Hello everyone. So for those of you watching today, we have a patient here that had a baby a couple months ago. So she is coming today for some stretch mark and scar revision. So we just kind of wanted to show you all that you can do the collagen pin, which you've normally seen kind of done on the face. You can do it on other parts of the body as well. So we're going to kind of focus on her stretch marks and her C-section scar. So what we will be, let her numb for about 30 minutes, cleanse, prep the area, and we'll get started. You can see she's got a tattoo right here that we have covered just so we can kind of avoid that area, protect that tattoo. But for, the moms out there that have the stretch marks, have the C-section scar, this is wonderful, wonderful to kind of help with that. So we'll just kind of get started with this. Very similar to when you see the collagen pin done on the face. Just kind of pulling the skin very taut, just going in small circular motions. You won't see a lot of that pinpoint bleeding like you've seen previously when we've done the collagen pin on the face. Just because obviously, the skin on, different parts of the body is very different. Are you feeling any discomfort? Okay. She just said it kind of tickles, so that's a good thing. No discomfort so far. That numbing cream normally does a pretty good job. So where she just had her baby a couple months ago, she's a very good candidate for this just because the newer those stretch marks are, the scarring, the more receptive, that skin will be. So you definitely, will have better results if they are, a little more new. And again, she's not feeling any discomfort at all, which is wonderful. And if, like I said, we can treat other parts of the body. We can do your neck, your chest, anywhere that you have scarring, obviously your stomach. And again, she's still not feeling any discomfort. And again, like I said, you can see we're not getting the bleeding like you've seen previously. We probably won't get a whole lot of that with her stretch marks. If anyone has any questions, feel free to ask. We are using a 36 pin needle on her today. We also have a 12, so we do kind of have a variety, two different ones that we can kind of play around with depending on the scarring and what part of the body that we're doing the collagen pin on. Like we said, the collagen pin, not only is it for your face, for collagen rebuilding, this will also help with any scarring that you have. It's great for other parts of the body as well. Yes, very good for acne scarring. We have a lot of clients that, will get this done on their face for that. And if you can see her stretch marks, they are still new. So they're pretty good in kind of that pink purple color, which again is why she'll be a better candidate, to have this done now, just where those stretch marks are more new. Doing okay? And again, we treat other areas of the body, you know, just like we do, you know, your face. As far as the downtime or taking care of, you know, this area of the body, it's very similar to the face. No sun exposure. You know, you'll want kind of a nice little ceramide cream to just kind of help with some discomfort that you have. Our client here, she'll want to wear kind of that loose fitting clothing, nothing super tight, to where it would kind of compress that skin. And for those of you that are just joining, we have a client here today. We are doing the collagen pin on her stretch marks and her C-section scar. She had a baby a couple months ago, so I had mentioned earlier that she's a very good candidate for this, just because the newer those stretch marks are, scarring, whatever it may be that we're treating, the more optimal your results are. And again, she's still not, you know, there's no discomfort for her. If anything, she says it tickles, so we'd much rather it tickle than hurt. And again, we let her numb for about 30 minutes, so she is pretty good and numb. I don't know if you all can see or not, but she is just kind of getting a little pink flesh on the skin, which is what we're just kind of looking to see. Again, like I said, you know, you won't see much pinpoint bleeding, which you all have previously seen when we've done the Facebook Live videos of the collagen pin on the face. And again, just like with the collagen on the face, you're looking to do these sessions about a couple, you know, 4 to 6 weeks apart. And again, as far as how many sessions you would need, that would all just kind of depend on, you know, the area of the body, the scarring, and kind of what results you're looking for. You know, some people might be able to get away with 3 or 4 treatments, some might need more than that. And again, just pulling that skin really taut so that we can really get in and around those stretch marks. Like I said, you can see she's really getting kind of good and pink. But again, she's not feeling any discomfort. If anybody has any questions, feel free to ask. And we can, you know, when we kind of get away from the face and other parts of the body, you can treat a little more aggressively. And again, that can depend on what kind of results you're looking for. We just kind of go in circular motions around that scarring. And once we get down to her C-section scar, if that area is still a little tender, so if it is too tender, you know, we won't necessarily collagen pin that today. We can always wait and do that next time. So we can always do just kind of your stretch marks if that scar was still a little too tender. Yeah, again, she just says it tickles more than it hurts. So again, this is a fairly painless procedure, so you don't have to worry about feeling too much discomfort. And again, like we said, you know, whenever she leaves here and for the next few days, she'll just kind of want to wear more loose-fitting clothing. You just don't want to cause any friction on that area just because, you know, it is a little raw and you don't want it to get irritated. So definitely nothing too tight-fitting for a few days. And like like I had kind of mentioned before, you know, the collagen pen, you know, it's not just for your face or, you know, just for fine lines and wrinkles. It's great for any kind of scarring, you know, on your face, on your body. The collagen pen is definitely kind of a universal treatment. Yes, so we used a topical numbing cream, and so we let her numb for about 30 minutes. So she doesn't feel anything right now. She says if anything, it just tickles. So there's typically not any discomfort with this treatment just because that numbing cream is really good. So it typically does the job to where you don't feel any pain. So this is typically, you know, not a painful treatment, which is nice. And we'll just kind of keep working our way across her stomach. Will she be sore afterwards? So typically it's not that you would necessarily be sore. That area could be a little tender just because you did get a really good treatment today. So that's why, you know, post microneedling, you know, we'll suggest that she wears loose fitting clothes, nothing that's going to be super tight or kind of compressing that area of her stomach. Just because if you do wear tight fitting clothes, that could just kind of cause that friction. That could cause you to be a little uncomfortable. And again, we do have very good ceramide cream, so if she was to be, you know, if that area was to be a little raw or anything like that, you know, she can put a ceramide cream on to help kind of soothe that area. Still doing okay? Okay. And like I had mentioned earlier, for those that are just joining, I am using a 36 pin needle on her today, but we do have a 12-point needle, so you do kind of have, you know, two to kind of choose from depending on the area of the body. How long does the procedure take? So typically you will come in, you'll numb for about 30 minutes, and then the microneedling itself can take anywhere from about 45 minutes to an hour. That would just kind of depend on the area that we're treating, how aggressively we're treating. Obviously, you know, a larger area is going to take more time, but you're typically looking at about 45 minutes to an hour. And again, you can see she has a tattoo over on her left side that we just have covered to protect from the collagen pin. So if you do have tattoos, we can easily cover those just so that they're not kind of in the way, or we're not taking the collagen pin over those areas. That's a very easy fix. And again, you can see she's just kind of getting a good little pink flush on the skin. We're not seeing any bleeding. And again, she's still feeling no discomfort. She's very, very comfortable. And of course, if anyone has any questions, feel free to ask. Still doing okay? Okay. Perfect. And again, we're just kind of working our way over her stretch marks. And you can always come in. We'd be happy to do a consultation with you if you're interested in the collagen pin, you have questions about a certain area of the body that you're looking to kind of treat. We'd be happy to come in and just kind of chat with you, and we can talk about different options to help with scar revision, whatever it may be. And again, if you all can see, she's just kind of good and pink where I've really gone in and around those stretch marks. And again, as we're kind of getting closer to that C-section scar, she's still not feeling any discomfort. She feels perfectly normal. And for those of you that are just now joining, We have a patient here today who has stretch marks and a C-section scar that she's kind of looking to treat. So we are doing our microneedling, which you all have normally seen us do on the face. We are doing that over her scarring. Microneedling is more than just for fine lines and wrinkles. It's for any kind of, scar revision, anything that you might have, and it can be used over the body. So on stretch marks, down your neck and chest, anywhere that you've got kind of areas that you're looking to treat. So it's a great procedure to help with any sort of scar revision that you're looking to do. And again, it's kind of treated very similarly to the face like you've previously seen. She'll have to just stay out of the sun, wear loose-fitting clothes post microneedling, just not to cause any irritation or discomfort. And again, we numbed her before, so she's not feeling anything right now. And we're just really stretching that skin really taut, just so we can really kind of aggressively treat those stretch marks that she has. If anybody has any questions, feel free to shout them out. I'll be happy to answer them. Anything about microneedling at all. I'm going to turn your settings up just a little bit. It's a little sore. Okay. That's fine. So she did let me know, in that kind of mid part, she is a little tender. So we will just kind of back off a little bit with our treatment. Alright, well I will finish up her treatment. What products are you applying to help with the slip? So we use a B5 hydrating gel. It's by SkinCeuticals. So it allows to get, some good slip on the skin without being, too thick. So this kind of gives a nice little glide to help the pen move, very smoothly over the skin. And in the B5 hydrating gel, there's hyaluronic acid, which is what helps to keep the skin very supple and plump. So it's a really good product to kind of, be able to infuse into the skin when you have those, you're kind of creating those little micro injuries to the skin. Alrighty, I'm going to go on and close down this video. If you all have any questions, feel free to comment below the video. We'll be happy to answer your questions. Like I said, we'd be more than happy to have you come in for a consult if this is something you think you'd be interested in. Y'all enjoy the rest of your day.